accompany him to a conference that we were having that winter and talk to the folks about our dream to build a clinic in our village. And you know, when Craig was emailing me, initially I was dragging my feet because it's winter and you don't want to do anything. But then in the email he put in a line there that said, it would be great to have a live Kenyan present to the audience. So then I wrote back to him and saying, live Kenyan? So I said, if I'm going to be the live Kenyan, well, that's not asking for too much, is it? So I showed up to the conference. And you know, for about 5 minutes, I told them about our background, not having a healthcare facility, and why we dreamt of having a clinic in our village. And it was amazing to see, you know, over that weekend, they raised over $8,000 that was dedicated to building this clinic in Kenya. And we came back from that conference, Craig and I, thinking, man, we only needed to raise $25,000. And if in 1 weekend we can raise 8,000, wow, this is something good happening here. This is something good that's about to happen. So that week, one of Nelson's advisors in medical school had met with him and to hear about his plan. Because every first year medical student should have a project locally or internationally. So Nelson presents this plan to build a clinic in Kenya, and so the professor asks, and how much is this going to cost? He says, we estimate about 25,000. Now how much money do you have? 0. So the professor, he didn't want to crush his dreams, you know? But deep inside he was just thinking, what a crazy guy. And so I called Nelson that weekend to tell him that we'd raised over $8,000. And he couldn't believe me. He thought I was just pulling his leg. And he said, this is kind of the worst joke I could ever make. But really, we had the money. So he said the following week, he goes back to the professor, and it was kind of just flying with excitement, knowing that we'd raised some money, and finally, what was a dream could actually begin to take root. And you know, between January, when we started fundraising, to June that year after graduation, you know, from middle schools, you know, the Hanover High School kids did a penny war. I had kids of my professor who would dedicate their funds for their birthday presents and dedicate it to the clinic. And people were writing me checks left and right. And back then we didn't even have a non-profit organization. So people would just write the check to me. And so I had all this money in my pocket. You know, just thinking back to that one day in response to Craig's email. And if I never took up that challenge, in my mind I thought, you know, there comes a time when somebody has to take that leap of faith. And for me, this was the time. And we were either going to fly or we were going to fall. But the thing is, you know, what was there to lose? We'd already lost lives and people were suffering. So I think for me, that was the moment of taking that leap of faith. And it's been amazing to see what God has done. How many people have come around us. The clinic opened in April of 2007, and we have grown tremendously. We built this 10 rooms, which was the initial outpatient clinic, and then we quickly realized people were coming, and we didn't have enough space. We didn't have dedicated space for deliveries. So we continued fundraising back in 2011, and we tripled in size. We opened a small maternity wing, and it's been amazing to see how just in our partnerships with the community and kind of just how far we've come. And it's not that we're there yet, but it's just amazing to see, some of the most exciting things we've done in terms of our outreach to the community when it comes to public health and maternal child health. I think this is where we've done some of the most exciting work. Dr. Young is here in the audience, and we also have some of our really strong supporters of Lawala in the audience. But it's just neat to see how, some of the patterns of the mothers seeking healthcare. Because back at home, like I told you, more than 70% of the women would deliver their babies in the traditional birth attendants, muddy-walled, grass-thatched huts, just because there was no healthcare facility. But that's what they kept doing. And so we had to reach out to the traditional birth attendants, reach out to the locals, and begin to sensitize them and say, now it's time to start delivering your babies in a healthcare facility. And in order to do that, the traditional birth attendants were going to be our key allies. So we recruited them as part of our community health workers network. And Dr. Young is an OBGYN by training. And there was some of the other folks who gave up their time and energies. We lost a lady, Ms. Brooke Baxter. She was one of the key folks who did training with the community, the local women and the traditional birth attendants. And unfortunately, she passed away in a road accident in Tanzania. But all these were people who laid the groundwork in us forming an effective alliance with the traditional birth attendants and a strong community health workers system. So the reason why I'm pointing this out is that after having a strong network of these traditional birth attendants and community health workers, many of them are actually women who never went beyond 8th grade, but they care about the community and they know everybody in the community. So they literally mapped out all the women of reproductive age and reached out to them during periods before they come to deliver, after they deliver, and it's amazing to see that once we had this in place, we saw numbers going from about 25% of women delivering in a healthcare facility. Right now we stand somewhere 96% of all the women of reproductive health are coming to deliver their babies in our healthcare facility and the nearby government healthcare facility. And some of the implications of these are rather outstanding to think about. If you can map out all the reproductive women, can we reach out to them, make sure all of them are HIV tested? Now, can we reach out to them and make sure that, just like some of the community health workers have the testimony that they've received their medications and they've delivered babies who are HIV negative, can we make this a goal that, in the next several years, none of the women will be delivering HIV positive kids? And this is kind of what we're trying to do right now. The Lawala Community Alliance, we realize that there's delivery of healthcare, but you quickly realize education, poverty, all these things come together. And so we are effectively a multi-dimensional organization doing work, trying to improve agriculture, trying to figure out how to improve education, sanitation, water, hygiene, because all these things work together to negatively or positively impact the healthcare of the people that we are serving in rural Kenya. I think I'll stop there and
I had a couple more questions and then we'll. So I remember in 2006, 2007 when it was just kind of getting started, and you know, it was a clinic and it was really exciting, and we, you know, as students we were super excited about it. But imagine my surprise when I checked out the website the last couple of days and just saw the huge growth. I mean, it's just been really exciting, and I think, to me, in my background with international development, one of the really important things you guys are doing is precisely what you were talking about, that connection between public health and all of the other things that are related. And one of the things I was really drawn to was Milton's blog post when he was back there, and you were also talking about, you know, the lack of running water when you were a kid. And so the blog post, they were just there with their 21-month-old, is that right? And she got very sick, and they didn't have clean water to kind of tidy her up and all that. So it really kind of had him thinking more about these issues of safe water. So I'm just curious, it seems like that's something you guys are getting more into. You know, can you talk a little bit about what you're thinking about with water and how that, what the complications are of that in the village, and how you're moving towards that, why that's important for health?
So in terms of public health,